Hi, good morning, and welcome again to this session of one of the lectures in pediatric anesthesia. So today I'll be talking about hydrocephalus. So as the name indicates, hydro means water, cephalus means head, as all of you would be aware. So what is this condition? Hydrocephalus is basically the ventricular system of the brain is filled with excess amounts of water. So that's hydrocephalus. So as an anesthetist, even if you're not doing pediatric anesthesia, this is something which you could encounter time and again. And so it's quite useful to know about this condition. And this condition might present in various ways where they will require the services of an anesthesiologist. So before we go into the lecture about hydrocephalus, we need to know about some physiology about the cerebrospinal fluid. So cerebrospinal fluid is nothing but it's formed from plasma as an ultrafiltrate, and the volume produced is normally 2 mL per kg body weight. It is produced by the choroid plexus, which is situated in the lateral ventricle and third ventricle, but it is produced predominantly in the lateral ventricle. From there, it goes into different spaces in the brain and the spinal cord. And so its distribution is sort of equal in the brain and spinal cord, though it tends to vary with age. And finally, about the CSF pressure, because sometimes they might want you to do a lumbar puncture for these patients and determine the opening pressure. So you need to know what the normal pressure is, which is around 0 to 10 centimeters of water. Coming to a little bit of anatomy of the ventricular system. So here we have, this is the lateral view of the brain. If you look at the picture, we have the lateral ventricle, the third ventricle, fourth ventricle, and then you have the fluid going into the spinal canal. So the next picture might be better. So this is looking from the posterior aspect of the brain. So here you can see that is the lateral ventricle there. So that's the lateral ventricle there. So the choroid plexus in this ventricle is where CSF is normally produced. From there, it goes into the third ventricle, which is situated there. Okay, and the opening between the lateral ventricle and the third ventricle is called the foramen of Monro, as mentioned here. Now, from the third ventricle, the CSF circulates into the fourth ventricle.